Hello, world and universe. Welcome to the Trevor Donald Experience. Manifest your truth. And if you're new to the channel, please hit that like and subscribe button. And for all my continued followers, I want to say thank you. And this is an opinion-based video channel where I try to open your eyes and ears up to some of the travails and tribulations that take place throughout our cities, our states, our country, and sometimes around the world. And I got to get into this controversial healthcare plan that was created during the Obama administration, and many people have given ex-President Barack Obama the credit for it, the Affordable Care Act, or Obamacare. And what exactly is it? How does it work? Who is eligible for it? All of those kinds of questions. Well, for starters, ex-President Barack Obama did not create the Affordable Care Act or Obamacare. It was actually funded and created by the founders and owners of Blue Cross Blue Shield, even though most of the credit goes to ex-President Barack Obama. And there are several caveats to the Affordable Care Act. One that's controversial is that premiums are high, deductibles are high. It was created for low-income individuals who needed some kind of health care insurance. But they're coming to find out that, as I said, premiums are high, deductibles are high. It has a limited network of doctors who accept the Obamacare plan. So it limits your access to network providers. But also, I want to tell you there's several different levels to your healthcare insurance. At the very top is your indemnity plan. So, for example, Blue Cross Blue Shield, where you can go to anybody in or out of the network. Then secondarily, you have what's called a PPO plan that has a limited network, deductibles, and you can sometimes go outside of the PPO plan. Then there's the HMO, which gives a lot of restrictions on where you can access healthcare and find providers. So HMOs are very restricted, similar to the Affordable Care Act and Obamacare. Then, of course, you have Medicaid, which has many restrictions. There are many hospitals and doctors that don't accept Medicaid. And then, of course, you have Medicare, which is generally presented for people that are under 65 on disability or for folks that are 65 and over. So those are your variances in plans. But marketed-wise, Obamacare was presented that it was something that was affordable for low-income individuals to have some kind of health insurance. But there's been a lot of controversy behind it with fraud and waste, government waste. And let's get into what this new report says. So this new report finds billions of taxpayer dollars wasted due to fraud in Affordable Care Act plans, or Obamacare. Estimates show millions of improper enrollments costing taxpayers up to $27 billion annually, every year. The Nonpartisan Government Accountability Office, GAO, Government Accountability Office, released a new report uncovering massive waste, fraud, and abuse in the Affordable Care Act marketplace plans. GAO investigators, remember, Government Accountability Office, using fake identities with no valid Social Security numbers or proof of citizenship, were approved for advanced premium tax credits, APTC. So follow this story. Monthly subsidiaries paid to health insurers on behalf of GAO's fake identities exceeded $12,300 per month, revealing how easily the system can be exploited. This investigation exposed that the scale of fraud in the Affordable Care Act, ACA, marketplace is egregious and is driving up costs for Americans who properly enrolled. Republicans are leading on common sense safeguards to protect taxpayers and stop the exploitation that Democrat policies have enabled. So here are some of the key findings from the Government Accountability Office investigation. Investigators created fake applicants that were reportedly approved for taxpayer-funded benefits, even when no identification documents were requested or fake documents were submitted. Every single fake applicant was approved by the ACA, the Obamacare marketplace, as recently as late as 2024, last year. So these are fake applicants and they've gotten approved. 90% of GAO's fake applicants are still receiving coverage in 2025. In 2023, one single Social Security number was used on an application for over 125 insurance policies, the equivalent of 71 years of health insurance coverage. 58,000 Social Security numbers receiving APTC matched Social Security death data. These people were not even alive. 94 million in taxpayer-funded subsidies were sent to health insurances on behalf of deceased individuals. These people weren't even alive. So why does this all matter? The use of fake citizenship eligibility documents confirmed fraud concerns for illegal immigrants. Insurance brokers were able to bypass verification by contacting the call center and submitting applications without the applicant being present there. People can be enrolled in plans without their knowledge while insurance companies collect these tax credits. Remember, I told you there's an association with the Affordable Care Act, Obamacare, and Blue Cross Blue Shield, regular indemnity insurance. CMS does not block new applicants using the same Social Security number. Big insurers are still collecting subsidies for deceased individuals. In the Working Families Tax Credits Act, Republicans passed solutions to restore accountability to the ACA marketplace through program integrity reforms that save taxpayers billions of dollars and drive down costs. Full income and eligibility verification before subsidies are issued, ensuring assistance goes only to those who qualify for Obamacare, ending anytime enrollment abuse that fueled fraudulent sign-ups and drove premiums up higher. Also closing loopholes that allowed illegal immigrants and other ineligible groups to access taxpayer-funded health care benefits. The Congressional Budget Office has found that these measures have already produced $185 billion in savings for taxpayers and reduced premiums by 0.6%. So you have all these irregulatory and abuse schemes that are going on that in the Affordable Care Act that is driving up the cost of your premiums and co-payments if you are utilizing the Affordable Care Act for your insurance. And so you had, even here in the state of Missouri, where Congressman Jason Smith, who is the chairman of the House Committee on Ways and Means, he said this: while Democrats defend waste, fraud, and abuse, Republicans are taking action to lower health care costs and protect care for all real living Americans. GAO's, that's the Government Accountability Office, troubling report is a smoking gun that shows how this broken system, shielded by Democrat policies, have led to the federal government shoveling tens of millions of tax dollars to insurance companies through identity fraud and cause healthcare costs to skyrocket for all Americans. Here again, as I said, we look at the relationship, for example, Blue Cross Blue Shield, their founders and creators, and their association with the Obamacare and Affordable Care Act. While Obamacare fraud is being confirmed by GAO, CMS, and CBO and other outside reports, patients are suffering. They face higher healthcare costs and denied claims or delayed care when their providers struggle to verify which insurance is valid due to these fraud schemes. Rather than simply rubber stamp more bad spending and failed policies, we must take action to prevent further harm. You have Congressman Jim Jordan, who's a Republican out of Ohio, who is chairman of the House Committee on the Judiciary, said that for years we were told we could keep our plan, keep our doctor, and premiums would go down. None of it happened. This new report confirms what we already knew. Under Obamacare, hardworking Americans saw their premiums skyrocket and their healthcare choices shrink. That's about your network and your availability to go to whoever you want to go to. All this fraud benefited insurance companies. Obamacare was built on lies and broken promises that hurt families and drove up costs. This is a very controversial subject matter. We know many of our middle class and lower middle class Americans are suffering due to high cost of all kinds of goods and services, let alone your health care benefits. And this is something that needs to be looked at and addressed. As I said, they give a lot of credit to ex-President Barack Obama for creating Obamacare, or the Affordable Care Act, which in actuality was being pushed by the owners and founders of Blue Cross Blue Shield. And we're talking about $27 billion worth of fraud and waste in association with the Affordable Care Act, or Obamacare, that is going out the door and out the window. And as a result, the individuals who are utilizing the Affordable Care Act, they are suffering from it, the negative and deleterious effects of this fraud, and it is driving up their premiums, their deductibles, limiting their network on who they can see. And this Obamacare scenario that started out as a great American dream probably is turning into a great American nightmare. Tell me what you think. This has been the Trevor Donald Experience.